Does anyone know what the sixth leading cause of death is in the United States? According to the Alzheimer's Drug Discovery Foundation, the answer to this question is Alzheimer's disease. Every 68 seconds, someone in the United States develops this disease. So whether you know someone personally who is suffering or knows of someone who is, everyone can be educated on Alzheimer's disease. In my speech today, we will be talking about the history of the disease, what the difference between Alzheimer's disease and dementia is, how the disease affects females versus how it affects males, and how Alzheimer's is presented in our world today. Dr. Alois Alzheimer first discovered Alzheimer's disease in 1960. After taking an autopsy of his patient's brain, he noted the shrinkage of nerve cells. However, he died in 1915 without knowing the groundbreaking discovery that would soon be named after him. In 1984, researchers identified beta amyloid, a protein that triggers nerve cell damage in the brain, which causes the memory loss. It was also discovered that the gene on chromosome number 22 codes for the amyloid precursor protein, the primary molecule that beta amyloid is formed on. According to the Alzheimer's Association, there are 7 stages of Alzheimer's. Stage 1, there's no clear symptoms. Stage 2, mild memory lapses. Stage 3, outsiders start to recognize the small things like forgetting names or where he or she put something. Number 4, medical professionals realize the patient cannot perform daily tasks and forget some personal life history. Number 5, an individual needs assistance with day-to-day chores. Number 6, severe memory loss, needs help with dressing and going to the bathroom. And number 7, all previous struggles but now cannot hold their heads up, reflexes are abnormal, and they have trouble swallowing on their own. Dementia is a decline in memory or executive function that interferes with the social function of an individual. Alzheimer's is a type of dementia that affects memory, thinking, and behavior. This is the most common form of dementia. Dementia is the general term used to describe a decline in mental ability that interferes with daily life. According to the Alzheimer's Association, Alzheimer's accounts for 60 to 80% of all dementia cases. Due to modern technology, we have evidence that shows the subtle differences in sexes in age-related disorders. According to an article published by the National Center for Biotechnology Information, during memory study tests, men perform better on spatial memory. But in contrast, it shows that women are better in performing verbal tasks and object location. So why is this important? These differences exist because of the way the brain is structured. The architecture of the hippocampus and hormone levels in the brain play a role. Studies show that the amygdala and thalamus are larger in men, where the hippocampus is larger in women. According to the Journal of Neuroscience Research, Alzheimer's disease has a higher prevalence in women than men, accounting for nearly 2/3 of Alzheimer's disease patients. There's no known treatment for Alzheimer's disease. However, there are medications which can help symptoms. Doctors also prescribe vitamin E, which is an antioxidant that protects brain cells from harmful chemicals that may cause damage. According to the Alzheimer's Drug Discovery Foundation, in 2014, Alzheimer's will cost the nation $214 billion. This number is expected to rise to $1.2 trillion by 2050 if researchers do not find a cure. If researchers were able to find a cure for this disease, it would save 500,000 lives a year. Today, there are also assisted living homes that specialize in caring for Alzheimer's patients. And not only are they caring for the patients, but also providing love and support to the family members. In my speech today, we have covered the history of Alzheimer's, how Alzheimer's differs between males and females, and Alzheimer's in our world today. It is a really horrible disease that affects 44 million people globally. This is a disease that not only affects the specific individual, but also their loved ones.